Hello, everyone. My name is Kevin Prof. As most of you know, since I believe most of us have been in classes together, I just wanted to apologize for not getting this presentation into you last week. I know it was supposed to be due then, but as you all know, life intervenes, and thankfully, Dr. Shannon has been very gracious in letting me turn it in this week. Um, I will be presenting to you the first chapter of Curry, Shield, and Wetle's Improving Aging and Public Health Research, Qualitative and Mixed Methods. To summarize, this chapter is basically an introduction to the rest of the book, which is evidenced by its overarching concept of how qualitative and mixed methods research have benefited multiple sciences, including gerontology, sociology, and public health sciences, as well as how it has improved the general uh, research process. Just to define, in case anybody doesn't know, qualitative research is basically a more subjective style of research. It's about opinions and perspectives on an event or product or any kind of opinion, which is then recorded and used for analysis of a different kind than, say, uh, quantitative analysis, which is about strict numerical or categorical findings that can be analyzed in a more statistical way. Obviously, then mixed methods is a combination of the two, where the quantitative analysis is done again with numbers, but then qualitative information is also collected in order to provide context and a deeper understanding of that data. Another thing that is included in this chapter is a discussion of different examples of how qualitative and mixed methods have benefited the sciences, which I'll talk a little bit more in detail of later. Important points from this article, or chapter that is, it discusses the different relevant fields and subfields that have been affected by qualitative and mixed methods research. In aging research, it has been applied to end-of-life care, health conditions such as Alzheimer's disease, Medicare insurance decisions, healthcare relationships, and experiences of caregivers in nursing homes. Essentially, it's talking about how uh, interviews with individuals have influenced their choices in their healthcare basically throughout their life. And in the cases of health conditions such as Alzheimer's disease, probably added a very strong perspective of what it's like to be with these conditions and then try and find ways of medically assisting them to make them feel better. Um, in terms of ethnographic research, it has provided in-depth information about racial and cultural differences in healthcare treatment seeking behavior. So, who goes to receive help and at what point they finally feel it is necessary, and in things such as experiences of caregivers in nursing homes, where we do know that certain groups of the population live or work more, so that causes different kinds of interactions, and so then they can gather qualitative analysis of that kind of information. And then also public health research is public health especially is affected by um, mixed methods research. In the book, they discuss vaccinations, which are um, benefited by the mixed methods because they use quantitative analysis to do calculations of what segments of the population are receiving these vaccinations, what groups are not, where they are going to get these not demographically, geographically. And then the qualitative analysis is used for finding what barriers individuals have from getting to uh, places to get these shots, what motivators get them to do it, and things that affect their decision process in whether or not they decide to get these vaccinations. And then once they have that information, they can combine them and use them to figure out what's the best way to get people to get vaccinated. So it's very important for the public health sciences. Another major point in the chapter is how the methodology, especially quantitative analysis, has been affected by a qualitative style analysis being added to it or used before it. it helps develop new categories and measurements for quantitative analysis so that um, they'll know what to look for when doing calculations. When you have, say, you're trying to gather opinions on a matter or try and calculate how common a certain idea is, first you have to do an analysis of what kinds of opinions are out there. So basically, it's just a concept of what things can be measured and how to measure them. It also has provided more context and detail to the results of analyses. Like I was saying with public health and mixed methods, by using them together, it allows a better understanding of the data so that it can be applied more properly when execution of plans and new programs finally goes in place. And then it's also good for developing new conceptual models for definitive quantitative research questions. So by actually gathering opinions and perspectives, it gives them new ideas of things to research quantitatively. Again, it's very much most powerful to use both qualitative and quantitative analyses together. As this relates to our class, we are all coming from a very different we're all going in very different directions with our degrees. We all have different concepts that we are going to take and apply in other places. I'm going in the field of adult education, and I know others who are going into research and administration at senior homes. So we all have kind of varying directions, but we're all united in the idea that we need to have a way of addressing, or not addressing, but evaluating what we're doing. And that's the point of this class, is to understand program evaluation and how that is benefited by both quantitative and qualitative analysis. We can look at numbers all we want, but it's not until we put those into a context and understand what people are looking for from us as well as what we're trying to give them that we can finally really address populations more efficiently. Okay. Pros and cons of the art chapter. One of the things I wanted to address that wasn't quite in the chapter, but it was the page before it, the foreword. It was a discussion of how we have to keep from losing ourselves in an analysis. We have to remember that the numbers we're looking at aren't just, a set of data that comes from a computer. It was once, somebody's actual opinion, an actual person who wanted to tell us something. It reminded me of a much more cynical view of the same concept from Joseph Stalin. You kill one person, it's a tragedy. You kill 1 million, it's a statistic. Once you get mounds and mounds and mounds of data and information, it's very easy to forget that this is actually affecting people's lives. This chapter also is very good at demonstrating the importance of its contributions to the sciences. It doesn't want us to just look at these concepts and focus in and just understand them. It wants us to wants them to feel relevant to us, that we're actually going to take this and turn it into something important. That being said, I feel that this chapter could have benefited from more concrete examples. The vaccinations in public health was really about it. It mentioned different important aspects of gerontology and sociology that it affected, but it didn't describe how. I would have really appreciated more information about, concrete ways that it's affected the sciences. So, as an introduction, that's what it is. It's just trying to hit those really quickly, but I don't know. I guess it's more just expecting us to go and look for this information ourselves, or maybe just because it's the introduction of the book, it's going to hit those later on. We're going to look at more articles because the chapters in the book are articles. It's going to discuss those points later on. Thank you very much, and I'll be half of the discussion board this week since my presentation's up now and I didn't want to ask any questions until now. Thank you, and have a great day.